When I was in pharmacy school at the University of Houston, as a P1, I was very involved in organizations such as SNAFA. And so whenever I heard about the program here in the RGV with DHR and how they help serve the Hispanic community down here, I was attracted to coming, and so I ended up doing my IPI. And through that experience, I was able to learn a little bit more about their program here and how they try to help cultivate a culture of family that's really open to learning and helping students continue to evolve throughout their journey.
So the DHR Health has a commitment to the community in both as a healthcare field, research field, and education. And our collaboration with College of Pharmacy, University of Houston has been tremendous so far. We want to expand that more into education piece because the residents are coming here and we are able to get our students into this program.
We are an acute care hospital, so we do see a vast majority of our patients who have diabetes, hypertension, high cholesterol as well. Anemia is another of the, chronic conditions that they come with. Primarily our services here at DHR Health Brownsville are outpatient surgery services. We do have OBGYNs, general surgery practitioners that come and do surgeries here, urologists, ophthalmologists, pediatric dental services as well.
The goal of a pharmacy residency program is to get 3 years of experience in one. So we really try to do our best to get our pharmacy residents there. And the pharmacy students, what we're trying to do there is basically get them to that residency level to prepare them to try to have that very rigorous type of residency, or even getting into the workplace. You know, it's a change, whether it's, you know, with the knowledge part and continuing to learn, or just basically, you know, working with different people, with people that may work differently than you, or something that you're not used to.
I think the RGV lends itself just from a population standpoint for opportunities for our students. The health disparities that are throughout the RGV, our students can learn from, and we can literally impact the lives of our population down here in the RGV that historically has been underserved.
I've done 3 rotations at DHR Health and also 4 rotations in Houston. And my preceptor, she was so approachable and I learned so much, as well as the doctors and communicating with the nurses. That interdisciplinary teamwork has really just made me feel like pharmacists have a vital role in patient outcomes and also medication adjustment and having them discharge and living their optimal lives.
We now have a pivotal role as pharmacists to better help these chronic conditions, and the main one is diabetes. And so they've been getting medications for years. Something that hasn't been present has been the diabetes education. The state of Texas has seen us as healthcare providers. Now we can bill for these diabetes education classes, and we can teach patients how to eat healthy, how to take their medications properly. Those continuous glucose monitors are now covered by insurances, and these patients come by a lot more, and I get to interact with them a lot more every 10 to 14 days versus every 30 to 60 days as I would see them before. Now that, you know, we have that deeper connection, some of these patients open up and they talk about healthcare concerns that they normally don't discuss. And those interactions and that trust that's now created will create better healthcare outcomes for the patient.
We really want to provide high quality care, and I think we do a great job, but we can't do it without research, without students, without the collaboration that we have statewide. And we appreciate what the university's doing. We appreciate what our leadership is doing. We appreciate the efforts that everyone's putting in to make healthcare in the Rio Grande Valley the best in the state of Texas.